There's very little known about patients who use multiple daily injections, especially type 1s, because historically they have their pens at home and they're doing, their own thing, and we have very little ways to get a lot of information about how they're actually doing anything. And there's been a few studies that are just questionnaires that are, a lot of bias, either recall or testing them, and then they're trying to, do good on a test. And there's not a lot about what they actually do at home. And so in this study, the larger study is a study with type 0 on a decision support system to facilitate more information and advice for patients using type 1, MDI for type 1. And basically what we're trying to do is give them some of the benefits that patients with using pumps or closed loop systems get. But we can't just take that system and just stick it on MDI users, because they're different people. There's a reason why they're using MDI. There's things that they like about it. And so within this study that's still ongoing, we were able to, with the smart pens from Novo Nordisk, we're able to get a lot more information about what they're actually doing at home. So what my poster is about is how often patients actually prime their pens, and then also how much. And so what we found was that, and this was patients who had just been taught to prime, like we had reinforced that. A lot of them had forgotten what that was. And the majority of patients did prime, but overall 80% of the injections I looked at, and I looked at about 16,000 injections, were primed. But when you looked at the patients, they weren't distributed on how often they primed. They were either priming almost all the time or very little. And what we found was the patients, kind of what we would expect, were the patients who were younger, they were all men, and they primed a lot less. But we didn't find any correlation to their baseline hemoglobin A1C. The findings on the priming, were kind of where I would have guessed people would have been priming, not all the time. I don't think anyone really was in a perfect our study. But I think what was most interesting is how from the engineering perspective of, can we just take a hybrid closed loop from a pump and then just stick it on MDI? And you can't do that. They're different people, they have different needs, they've had a lot of control in what they've been doing, and they're not used to having to interact with all these different steps. So I think that's been the most surprising thing in the development of it, and just how much little we know and how much more we need to know about this population in order to, the majority of type 1s use multiple daily injections, and it's a huge area that we just don't know anything about. So I think that was probably the most surprising thing to me going through the study. I think that's what this really allows us to do with these pens, that now we're getting more information, is to really know, when we're teaching them, we don't really know how often patients are priming, so we don't know how much do we really need to emphasize this. Like, I know that since doing this study, now I've been emphasizing it in a different way than I might have previously, because a lot of us assumed that the patients were priming. We were just reminding them and going through our step, but actually maybe we should be emphasizing it. It's something that, since we don't know what they're doing, we've never really emphasized it in their whole history, because we don't usually see them doing it, we don't usually interact with that part. So I think having more information about what patients are really doing at home is going to allow more of an interaction on what the patients really care about, what they're doing day to day, instead of our checklist of things we want to tell them.